it's your turn for questions and comments. Okay. Are you going to run around?
You want to run around? Or? Okay.
Okay. The boss is going to run around.
He's got the mic in his hand. He's dangerous.
Is it on? Is it live? Is it coming out?
Kelly, you hear me now? Yeah. This is Kelly Kent from Neighbors America. I told him to kind of share with his perspective, watching a lot of different groups in this space. And so I'm not sure what your question is, but feel free to add to the conversation.
Well, first of all, I just wanted to thank the panel. I think everyone made very good points. And so really, the only thing I would add to it is that I think that, Marty, the point you made about Medicaid and HMIS data and how telling that is. And, you know, I think we need to be able to make that case in a more, you know, I think there are very few states that can really get their Medicaid and HMIS systems and do that kind of connection. But I do think, I was just at the American Public Health Association conference this week, and the discussions around the fact that public health officials are now, you know, publicly saying that they are making that connection very readily, that the hot spots around disease are often the most disadvantaged communities, and being able to connect those dots at the local and state level, and even the federal level. But you know, for us to be able to do systems change work in our communities and approach hospital systems and public housing authorities by saying, look, you know, we absolutely need to come together at the table and begin looking at how we do this and invest our scarce budget dollars, because those that are most impacted are also those that are revolving through our hospital systems. And I think that with the ACA and the impact on readmissions with hospital systems, we now have a point of leverage to get the hospital systems more engaged in that conversation. I think if, you know, if things continue to move the way they are going, I think that we will see a lot more community development dollars being invested into disadvantaged communities, which are hotspots for public health and readmissions to hospital systems. And the point that I wanted to address that Dexter made was that I definitely think equity has to be a point of every conversation in these communities, as that community investment is put into disadvantaged communities, because of the fact then we're just going to see gentrification and our most disadvantaged residents pushed to new communities. And so, I mean, we've seen it time after time. I mean, the war on poverty has been going on for what, 45 years, and the percentages are about the same as they were. So ultimately, I think that it's on all of us in our communities to really develop systems change approaches and educational tools that we can approach our leaders in our community, the hospital systems, the housing systems, public health, and our local city councils, mayoral candidates, et cetera, and really make the case around why we need to be working together on this.
Is Neighborhood Works involved in this Healthy Futures Fund?
The Healthy Futures Fund is actually LISC. The thing that I will say is that every national intermediary is now looking at this issue much more intentionally. NeighborWorks has staff that work on the intersection of health and housing. We are doing a national Health and Housing Symposium in December. LISC, Enterprise, Leading Age, I mean, you know, the list goes on, CSH, the list goes on and on. Folks are very much placing focus on this, but I will just say that, you know, and Marty could speak to this very well, the Corporation for Supportive Housing has been working on the issue around homelessness and supportive housing for over 30 years, and they largely gained traction in supportive housing as kind of the leading way to reduce costs costs and increase housing stability for vulnerable populations over time through systems change advocacy. And I think a similar approach needs to be taken with public health and housing around the larger health and housing issue, because I think until taking it to scale is going to be the challenge. And so I think the similar strategy could be taken here.
Any comments from the panel about that?
Well, I just would add about taking it to scale. I think we need the DHICs and the organizations who do your work at the project level, but we can't just think about it's okay just to fund a project.
Yeah, I was going to ask you that same question. I mean, we can gather all the housing authorities together and all the nonprofits doing good work on affordable housing and some of the for-profits, but still, I mean, it could very well be that the biggest impact is going to be the non-assisted housing that's
right.
privately owned, it's owned by individuals that, and how do we address that and how do we bring that into the equation? And I don't know if anybody from Greensboro Housing Coalition is here, but they have been, I think, doing some good work. Good. How about if I give you the mic? Okay, all right, I can come your way.
So we've been doing a lot of work in this area, and I also wanted to ask, when we were talking about who gets the savings, in the last little bit around the area of health impact bonds and the pay for success models, and I wanted to get you guys' ideas on what has been done and what's kind of coming down the pipeline in that, and who's funding these things. That's really kind of my big question with those.
Well, I think there's a lot of big unknowns right now because on the bond side, you're having to look at a stream of money that you're going to be able to shift. And, you know, there's been some successes in the past with shifting state dollars from the state legislature standpoint into a different way of doing business. But most of those efforts over the years, whether it's closing hospitals or doing some other shifting of a large portion of the state budget, for example, which would have to be used to pay off the bonds, those funds get dispersed out to other places. So unless you're very intentional about the stream of funds that are going to come back in, I think we have, you know, there's many challenges yet with respect to bonds. I think that I do think, going to Greg's question about private housing, absolutely, that's where most people are still living in private housing. And what's the effort there to incentivize private landlords to do exactly what David was talking about today? And I think there are very few examples, but for example, in Pennsylvania, with the Gas Exploration Trust Fund. Does anybody know what gas exploration is?
Fracking.
Fracking, okay? So finally, after people couldn't afford to live in their own communities in the north central part of the state was convinced to create a trust fund from a fund source, it's like a housing trust fund, into the rental housing, multifamily rental housing, which had not been improved in those old coal fields, let alone the new system, to get a different stream of going in for private owners, not just the public. But unless you have a stream like that of resources that can come in to the homeowners and you can hold them to the requirements over an extended period of time, it's very hard to do. But it should be on the table because of where people are living. If we can't get into the private, you know, multifamily world where most people are living in these situations, it's not just in the public developments.
So I think there are some noteworthy examples out there. There's these social impact bonds. Fresno has championed some of this as a way of getting private sector dollars into some of the projects that we care about. This is also, by the way, we haven't talked about this before, but this is also a role for philanthropy. Some of these bonds early on need to be guaranteed. And, the feds might do it, but good luck with that one. So I mean, part of the debate in this country has to be about, yes, we need to continue to push for proper investment of public dollars, but we also need to create market financing mechanisms so that we are right about these savings. They're real, right? And so there should be financing mechanisms that we can put in place, maybe with guarantees from philanthropy, so that people will invest, the bondholders will get payback on their investment, and we will also benefit by these sorts of improvements. So I think they're still being formed, but social impact bonds, it's an entirely private sector effort. So I think it holds great promise.
I think, for example, the banks in southern Louisiana are going to consider this. So if you can you've got to get, I'm not sure philanthropy is always going to be able to hold it up either. I think it's got to be a mix of philanthropy and private investment, right? I mean, philanthropy's great, don't get me wrong. It's just that I don't think they can write the big enough checks yet.
So I kind of sidetracked into health impact bonds when we were kind of going to talk about what was doing with private landlords and what we've done in Greensboro. A good bit of what we've done with private landlords in Greensboro to try and make their housing healthier is policy work around working directly with the folks at City Hall on code enforcement. And we've been rather successful in that arena. But we've also been doing a pilot study with our local health system, which is Home Health in Greensboro, around pediatric asthma or childhood asthma. And we're going in the house, we got their top 40 or whatever kind of randomized patients, and we're going into the housing to see, do an assessment and see if there's something there. And so a portion of the sample, a large portion of the sample is Section 8 public housing, and then some homeowner, and it's kind of a mix across there. So we've had to do some interventions where we've used kind of carrot and stick type approaches with landlords when we find these really bad housing situations where we say, okay, we'll put some money into it, but you got to put some money into it and have some skin in the game too. And we're not really at the point of having data on this work yet, but within the next 6-12 months, we'll see how that all worked out for us, and it'll be interesting to see.
And some of that's financed with foundation dollars, as I understand it?
Yeah, we had we're still working on a grant that we had through the Kresge Foundation, the Advancing Safe and Healthy Housing Initiative. So that's the money. Cone didn't put any money into it because Cone's perspective, and rightfully so, would be if you're taking patients away from us, you're taking dollars away from us. I mean, they're not saying that, but that's the reality. But when they found out that probably 80% of our sample was Medicaid patients, they kind of changed their tune because they're not getting reimbursed at the same rate. So they're like, oh yeah, well, this is great. Keep these people out of our hospitals.
Thank you.
Yeah,
I wanted to ask Dexter, the Y has a connection with Wake Med, and is that a building block that can move this conversation further as you look to move more into be a more active player in low wealth neighborhoods?
Yeah, one of the things that we are looking at is what makes a healthier, safer community. And we've been looking at models across the country, and one of the models that we looked at was in Atlanta at East Lake, in the East Lake community. And so we saw they had three things. They had health and wellness, education, and mixed income housing. And so when you talk about doing a community transformation project in order to impact all those areas, it goes back to the common theme that you've been hearing around here all since we started this morning. It's collaboration and partnership. So how do you begin to work with folks who has the expertise in certain areas in order to bring those services into the community so the community can access those easily. And so we've been working with Wake Med in order to address some of those issues and a number of other organizations that we're in conversation with and vetting as we continue to move forward in underserved communities.
And has the Y been part of the community needs assessment process of Wake Med? I mean, have you been an active player in that all hospitals?
We've been at the table, and I think that's a lot of times organizations don't have a seat at the table when you're serving the community. So we've been at the table, and I think when you think about the table, who's all at that table though? And then you got to have that outer circle table as well, and then that outer circle table as well, and it's all connected in order to make real transformation.
Well, maybe that's another reason you're on the DHIC board, so
Yeah.
you can bring us to the table.